So as pediatric rheumatologists, we are used to collaborate with many other disciplines because we need all their impact and we need all their help also in our daily life as pediatric rheumatologists when we take care of children suffering from these diseases. So we need nephrologists, we need cardiologists. So we are used to really work with many disciplines. And I think this is maybe also an advantage for us in a way that we do this already in our daily life, and we also are very much used to communicate with different disciplines, with different colleagues, and that makes it quite easy to also do that here within the groups we meet at within EULAR, at the conferences, at symposia and everywhere in the world. So we are used to this already. We are increasing our networks, our activities in different projects, and this has led to most of the success we have in the field with regard to management and also therapies, because without international cooperation we were nothing. We as people working in pediatric subdisciplines always say that children are not simply small adults. So it needs more than just adapting doses from adults to children, for example. Just downsizing things will not suffice. So we clearly see that it is difficult to care for children and adolescents with rheumatic diseases because they are not simply small adults. So there is the complicated, let's say, area of rheumatology where we often cannot explain to the families what the diseases really is causing. And on the other hand, there is the problem of childcare, where we need to see the whole developing child with all its needs and take that into account in all our management approaches. Also talk to the families, of course, and that makes pediatric rheumatology and this population certainly a very special one within the whole field of rheumatology. I think one of the most impressive advances we had in the past, let's say maybe 3, 4 or 5 years, was that we also took advantage from approaches the adult rheumatologists were using with a treat-to-target idea, which gave us a new mindset in approaching families and patients, predefining targets we want to reach, then adapting therapeutic steps. And with earlier treatment, we now see really an improvement we haven't seen before. We see that we can get much better and reach a much better health state in children. And this is something that developed over the last 5 years. I would say in 2018 there was a publication on a treat-to-target strategy combined from the pediatric side and EULAR for kids with juvenile arthritis, and this really is since then a major step forward.